Hey guys, welcome back to Mundane. I'm your host, Lusina Toure. So today's topic will be on NHIF, or rather the National Health Insurance Fund. I really have an issue with this insurance policy. This is because at a certain point, I kind of like was going on for a checkup. I had like tonsils and like I needed them to get checked out. So I went to like I don't know if it's a level 1 or a level 2 hospital, and kind of like enrolled on antibiotics and all, and whatever they prescribed. And so after my treatment, the tonsillitis was still there, and kind of I had to like go and get like a major checkup on like more of like a referral hospital. So I think that's a level 4 if I'm not wrong, or a level 4 or a level 5 hospital. So I went to KU hospital, the referral hospital that is along the Eastern Bypass. And when I reached there, and I kind of like went to the front desk, and I was kind of inquiring on how to go about it and everything, on how to see a kind of a throat specialist, and I was told that my NHIF is null and void because apparently these hospitals only cover civil servants only. So I was like, okay, and why is that? And they were kind of like, that is the policy. And I was like, okay, chill. So you are telling me that I have been paying premiums for the last I don't know how many years, and you're telling me that my insurance package is insufficient and cannot actually afford me to acquire healthcare in this institution, in this fine institution. People are saying, what is happening in Kenya? Because we will actually go crazy. What is the purpose of actually paying a mandatory health insurance package if it's not actually going to do shit for you? Huh? So apparently I had to go back to my pocket and actually fund it. This is your expenses and your kwangi umepangia, uncalled for expenses that you had not planned for. So you go back to your savings and kind of like take a huge chunk again to actually go and use it for healthcare provision. Why? I really don't get it. I mean, and I started actually doing research with regards to this issue, and I found out that it's actually true. Excuse me. Kind of like level 4 hospitals do not actually accept this. They do not allow, kind of like the national coverage. They do not. So the differentiation on national civil servants in Ghana, because I'd like to know, is it because they have like a stable pay from the government, or I don't know, is it because they won't miss their dates, or I really don't get it. Because at the end of the day, I know very well I pay my premiums, I'm up to date, and if I can't use this specific health package to actually seek healthcare, I do not understand why am I paying for it. It doesn't make sense to me anyway. So my call is to NHIF. They really have to come to tell us why this is happening, because I really do not accept what is happening on the ground. So many people are struggling out here to actually pay your premium at 500 and not to, so that they cannot be fined. And at the end of the day, you find that you cannot actually use this specific policy to actually acquire healthcare. It doesn't make sense to me at all. If it's mandatory, then it should be mandatory for every healthcare, sector that you're seeking for, because at the end of the day, mbona wana categorize the vitu kwa nini? Because it's a mandatory healthcare policy that you have to pay from the it's a government national, or rather a national government scheme project with regards to universal healthcare. I don't know what kind of healthcare they are talking about, but definitely it's not universal out here. Kwa grow vitu ni tofauti. We are not getting it. We are not receiving, that universal healthcare that you are apparently talking about. Because at the end of the day, we have to go back to our pockets and like pay for these extraneous, very expensive, healthcare procedures. And hamtusaidii at the end of the day. Juu sielewi mbona analipa hiyo 500 at the end of the day. If kama sitatumia hiyo policy ku seek healthcare, I don't see why I'm paying for it. Because if I'd rather be paying that 500 in a hospital for every month. Because at the end of the day, I know as much as I know I'll be building my credit worthiness in that institution, and they will actually consider, actually providing the services that I need with them, rather than paying for this policy. And at the end of the day, I'm not getting any help with it. I still have to go to a different agency or rather healthcare agency to actually seek the services that I need. So I don't understand. So NHIF, I don't know, the national governments need to actually look into this. These policies, or rather this policy needs to change, because at the end of the day, I don't feel like it's actually helping the common Mwananchi. The local Mwananchi is suffering because not many people, are kind of like employed or rather in corporate or rather getting their salaried. But when you kuinje ni hustlers, and they really depend on this cover. And it really is sad when you hear that mtu amekukilipia hii with the, at the back of their mind they know very well that unless kuko na emergency, because no one really expects to get sick at any point, it just happens and you really need to get medical care. So unaenda kwa hospitali unaambia huwezi tumia hiyo policy. I mean, it doesn't really make sense to me, and it needs to change. Honestly, it does. It has to change. If it is a national government health scheme, it really needs to project that it is helping the common Mwananchi. Because if it is not, you really didn't itoe tena from being like a mandatory kind of like policy that every Kenyan needs to pay for. Scrub it off. Because at the end of the day, if it is a mandatory policy to pay, and at the end of the day, like, ambia mtu akwa na save your 500 anaenda kutumia kitu kwingine. Juu at the end of the day, haitusaidia hata. You are paying it and you cannot even use it where pali unafaa uitumia. What is it for? Honestly, what is it for? Ama nataka kutuambia like tunafaa kutibiwa from a, at a specific level, and uko kwingine to struggle for the rest of our lives. I really do not understand. As much as anyone can actually afford to pay, healthcare should be accessible to anyone, regardless of whether they are working in the government, in the village, or anywhere. No one cares about where you are working or whether you are salaried or anything. If you are able to actually pay your premiums, the health policy should cut across all individuals, regardless of age, whatever and whatever and whatever. Everything else needs to be included in that policy. So I actually feel like this needs to be redrafted. It has to be redrafted. I don't know who exactly works with this. I don't know if the parliament actually takes part in this. But I know for anything to work, to be passed by the national government, it has to have, at one way or the other, imeguziwa na parliament. So I hope our MPs and everyone else involved is they're actually doing their research and providing, better policies for us, the local Mwananchi, because we really need this. We really need this to prosper in life. Healthcare is really important. It's one of the sectors that, if it's lacking, so many of our people are going to suffer, and it really will affect so many other people. So yeah, that's my take on NHIF, and I feel like it is a scam. It is a scam, and this needs to be handled like yesterday. It needs to be handled like yesterday. It has to be handled. So I'm calling to you guys to actually, offer insight with regards to this specific issue. I know not only I, and I believe so many of you have actually been affected with this specific policy, the National Health Scheme. And if you actually feel if it's a scam, actually, let's jumpstart a conversation and actually talk more about it. And hopefully, we can build traffic and actually get all the people involved in the drafting of these policies to actually pay attention to our needs. Because at the end of the day, they are there to work for us, not the way around. We are not working for them. They are there to work for us. Because at the end of the day, the government is there to support us, the local Mwananchi, and that is the purpose of actually us voicing out our opinions and ideas on how things are supposed to be run in the country. So thank you guys, and see you on my next video. Kindly don't forget to subscribe, like, and share.